Hello, and welcome to our webinar on lead exposure. Today, we will be covering two different topics. The first being an overview of the health effects of lead exposure and an overview of the OSHA lead standard. Vicki Ainslie will be covering that content. And then after that, I will be covering how to prevent take-home exposure to lead and what the roles of the employees and the employers are to protect families at home. So I'm going to turn it over to Vicki.
Hello. This slide is just showing you the two OSHA standards that we're going to talk about related to lead, and OSHA is the Occupational Safety and Health Administration. And these two standards, 1910-1025, covers general industry activities, and 1926.62 covers construction activities. And after I give a discussion of the health effects of lead, we're going to go through the key components of those two standards for you. Lead is an element, this as shown in the periodic table on the right. And the types of lead in this slide, what I'm referring to, are the types of lead that OSHA regulates with those two lead standards that I talked about. Metallic lead, all inorganic lead compounds, and organic lead soaps. Organic lead soaps are less likely to be a concern for most individuals in general industry and construction. However, they do pose significant concerns if you are work in a museum or are a conservator of historic paintings made with oil paints. Oil paints, of course, are also comprised of, have lead in them. That's what gives them the bright colors. The standards exclude other organic lead compounds, and the most obvious example of an organic lead compound is tetraethyl lead, which is leaded gasoline that we used to use in our vehicles. And it's still allowed for certain uses, but not in general use for vehicles in the United States. So that particular compound and other organic lead compounds are not regulated by OSHA's standards. This picture, excuse me, is showing a couple one is an advertisement, the one on the left from National Lead Company in 1910. And it's basically just illustrating, using the Dutch Boy painter, which was a brand of paint, that lead, trying to demonstrate that lead is good paint, and it is very good paint. Lead paint was expensive paint, relatively expensive paint, and it was good. It lasted a long time because of its ability to sort of expand and contract a little bit with the coating without breaking. Lead comes from the Latin plumbum, and that's where the Latin word for lead, and that's where we get our words, obviously, plumbing and plumber. And the benefit of lead was it's a soft, rather malleable metal, and it's able to expand and contract without being brittle. So that's why it was used in solder and pipes and things like that. It could take cold temperatures, especially, without cracking. So that's just an advertisement showing that lead paint was popular for use in housing and other commercial and industrial uses. On the right is a picture that was the cover of a Newsweek magazine issue, I think in the 1990s. And that is what most people think of when they hear about a child who's lead poisoned. The child lives in dilapidated housing, the child is unsupervised, and the child is allowed to peel the paint off the walls and eat it. Now, that is a way to get a child poisoned. However, that is not how 99% of children who get lead poisoning typically get lead poisoned. They get poisoned from invisible dust that accumulates from slowly deteriorating lead paint often in residences. And obviously, as we know from various news reports, water is also, lead in water is also a possible source for children. So most children who get lead poison, it has nothing to do with their people's parenting, families parenting. It has everything to do with normal hand-to-mouth contact that children do, especially when they're crawling and not walking yet. It is completely normal behavior for a child. Everything they encounter as they're crawling around to go right into their mouth. So that picture is a bit misleading, because that is not how most children get poisoned. I just want to define lead-based paint, because that is a term you will see in EPA, the Environmental Protection Agency regulations, as well as the Department of Housing and Urban Development's regulations and guidance. Paint, varnish, shellac, or other coating on surfaces that contain 1.0 milligrams per cubic centimeter or more of lead, or 0.5%, which is the same as 5,000 parts per million or more of lead by weight. So the first unit, 1 milligram per centimeter squared, is typically going to be collected using an instrument called an XRF, an X-ray fluorescent analyzer. And that is actually typically used on paint installed, so they can shoot walls, ceilings, painted trim inside and outside the house or structure to determine if it has lead paint, and the units are given in that amount. The other way you can get your lead paint results in milligrams per centimeter squared is by taking a carefully excised paint chip and scraping all the paint from inside that. Usually it's a 2 by 2 inch square of paint, and then asking the lab to report the results in total milligrams of lead, and how many square centimeters you measure, you collected the paint chip from. However, more commonly, when you're doing paint chip sampling and trying to determine if the paint has lead, the inspector will scrape a piece of paint off, making sure you get down all the way to the substrate, and send it to the lab, and they won't measure it. So then in that case, you get a percent of lead as compared to the total weight of the sample, which is lead by weight, which is also how many parts per million of lead per, how many parts of lead per million parts of sample. So those two are equatable. So 1.0 milligrams per centimeter squared is not equal to, you can't convert it to 0.5% or 5,000 parts per million. The Consumer Product Safety Commission, on the other hand, CPSC, who has lots of rules about consumer product safety, has a lead containing paint definition, which is much lower, 0.009%, which is the same as 90 parts per million. And that is, I would say, the easiest way to keep the difference is in your mind is that is what a can of paint that you would buy at a paint store or a hardware store would be allowed to have in it. OSHA, on the other hand, again, the Occupational Safety and Health Administration, within their standard, they don't have a definition for lead-based paint, because OSHA regulates any kind of product that might generate a lead exposure to a worker, not just paint. So they say any detectable level of lead, then the competent person, which is something that an OSHA standard requires, for the employer has to determine either through air sampling or by historic information what that item that contains lead, if they disturb it, grind on it, sand on it, cut it, if that will generate lead at a certain level in the air to expose the worker. Okay. So how lead can harm your body. Unfortunately, lead looks to the body like iron, and it also looks like calcium. And both of those elements are needed for our bodies to function. So the lead actually is attracted and binds to the red blood cells, and therefore goes throughout the body, wherever the blood forming system or the blood, our veins and arteries take the blood. It prevents cells from carrying additional oxygen. It damages the red blood cells. It actually damages the blood forming system in the bone marrow and reduces the ability to make more red blood cells. And it also can cause high blood pressure, both because of its effect on the heart and blood system, but also its effect on the kidneys as the body tries to get rid of the lead that's in the body. 65% of lead in the blood is filtered in the kidneys, and unfortunately, as it's being filtered, it damages kidneys. There are other metals that also have similar reactions in the body and damage organs. Typically, the damage to the kidneys might not be noted until it's too late, and ultimately can lead to kidney failure. The nervous system. It's the most affected by lead. The damage is permanent. A pediatrician who used to deal with lead poisoning prevention in children in Richmond, Virginia, taught me a nice little analogy. Doesn't work as well with cell phones as it did with landlines, but when children are born, we have our telephone poles all installed in our brain, if you can picture that. And between 0 and 72 months of age, which is basically 0 to 6 years of age, all the connections of those telephones are in process, are being made. And lead can damage the ability of those connections to be made. Either they're not made at all or they're not made properly. So this damage is pretty much irreversible. So it can result in all sorts of different symptoms: depression, irritability, forgetfulness, clumsiness, learning disability. And of course, high exposures, both in children and in adults, can result in death, although death from lead poisoning is extremely rare in this country. There have been, since I've been doing this work since about 1987, there have been a number of children that have died from various exposures to lead. Not necessarily, all of them were not necessarily related to lead paint. One, in fact, was related to a piece of jewelry that she had, and she kept putting it in her mouth, and unfortunately it had a high lead content that nobody knew about. Lead also goes into the bone tissue. Lead in the blood is deposited in the bones. It unfortunately also prevents then calcium release into the blood. It blocks the production of new blood cells. Bones and teeth store 95% of what we call a body burden of lead. How much lead we have in our body is usually stored in the bones and the teeth. It's also stored in hair, and it's also stored in soft tissues within the body, but not nearly as long as in bone. It can be stored in the bone for over 30 years. And there are situations under stress, and a stress could be something like a fracture. You break a bone, the bone that's in your, the lead that's in your bones can be mobilized back into the bloodstream. Wasting diseases like HIV/AIDS, immunocompromised diseases, cancer, inactivity. Also, if you because of an injury you're immobilized, it can increase the risk of lead being released from the bone. The female reproductive system, it reduces fertility, it affects menstruation and menopause. During pregnancy, unfortunately, the body absorbs, because the body has a fetus to feed, the body absorbs lead more quickly, 50% of what is inhaled or ingested. Again, these are averages. Everyone is different, a little different. It does unfortunately cross the placental barrier and pass from the placenta to the fetus. So if the mother is lead poisoned as part of her occupation and she is pregnant, some of the lead will go to the fetus as well. Obviously, that is at its most sensitive stage, the fetus, so it can cause brain damage, miscarriage, or premature birth. And again, if you had a history of lead exposure before you got pregnant, pregnancy can increase the release of lead from the bone into the blood. The male reproductive system, decreased libido, infertility, damage to sperm, damaged motility of the sperm, movement of the sperm, and increases the spouse's chance of miscarriage, premature birth, and birth defects in the child, the fetus. So we're talking at this point a little bit about adult reactions to lead. And as you can see, even at levels as low as 10 micrograms per deciliter, and I'll explain a little bit in a future slide on what, when we're talking about micrograms. Micrograms is a millionth of a gram. You cannot see 1 microgram of lead dust, let's just say, if you had a microgram of lead dust on the ground. And a deciliter is about a half a cup. So these are the levels that you would see if you got a blood lead taken. They would report the results in micrograms per deciliter. And even at levels as low as 10, you see an increase in blood pressure, harmful effects on the fetus. 15, joint and muscle aches. This is in the adult. Again, joint and muscle aches. I just got a COVID shot and a booster, and I had muscle aches the next day, which I attributed to my body's immune response. So there are lots of reasons that can cause joint and muscle aches, and a worker might not automatically assume it's caused by lead poisoning, which is one of the problems with being poisoned by lead. The symptoms are sort of non-specific unless you have very high levels. Reproductive problems can start as low as 20, and I would say probably even lower than that. The research is continuing on how lead and other metals affect our various systems in our body. 40 micrograms per deciliter, kidney damage, damage to blood formation, 60 micrograms, anemia, irritability and fatigue. This is where some of the nerve responses come about, which includes sort of memory and concentration, having trouble sleeping, irritable, tired. Again, those are very common symptoms and can be caused by any number of diseases or issues you might have. So you wouldn't automatically assume, oh, I've got lead poisoning. And then 80 micrograms per deciliter and over. Sometimes there's some physical things that they can see. There's actually this item called a blue line on the gums, which again is very unusual since we have an OSHA occupational exposure limit for lead, but it certainly wasn't unusual, back in the 30s, 40s, 50s, when we were using lead paint regularly. So how much exposure is too much? How quickly does lead impact us? And I have 2 pictures of children, and both of them are chewing on something, have put something in their mouth, because that is exactly how children most often get exposed to lead, through ingestion. If you are an occupationally exposed worker, occupationally exposed to lead or other dusts, then your most likely source of exposure is going to be by inhaling lead fumes, tiny lead particles as part of your work. With children, it's mostly ingestion. So, and they are a tiny package, and their processes in their body, they're growing rapidly. So even small exposures can result in high lead intake for children. Children absorb more of what they ingest than if an adult ingested the same amount. A child absorbs significantly more of it. Again, just because their body is growing so rapidly. So lead dusts are a very important exposure pathway, and it's both for adults and for children. But what we see as sort of the worst case scenario is an individual who works in demolition or construction, gets exposed to lead dust at work, does not decontaminate, wash their hands, face, take off their work boots or clothing, and tracks that dust into the car or vehicle and picks the baby up from daycare, and the baby then gets exposed in that same vehicle, and then goes home and puts the clothes in the laundry, and the dust gets spread through the house. And that is a real risk with occupationally exposed workers. Health effects on children. I've talked about some of this. Most of the health effects we were talking about earlier are on adults, but a little, I also talked about children a little bit. The problem with the brain and developing properly, if a child is exposed, especially between 0 and 72 months of age, these items listed on the slide are in most cases non-reversible. And again, the fatal dose for a child is much less than the fatal dose for an adult because they're a much smaller package. It can affect the growth of long bones, so their longer bones in their legs and arms might be shorter than they normally would have been had they had no lead exposure before 6 years of age. And liver dysfunction, anemia, again, on the fetus we talked about. I also want to make sure you understand that it doesn't mean that at 72 months automatically then there's no risk to children. Then they become a little bit more like an adult, but again, they are still a smaller package. They're a smaller body than an adult. So they still have the risk of all the same problems with the blood forming system that the adults have, and they would have probably more effects at a lower exposure than an adult. So these are what were considered acceptable childhood blood lead levels. And these are by different agencies. The Centers for Disease Control and Prevention is typically the agency that we think of that because they do fund a number of childhood lead poisoning prevention programs all across the country. But as you can see, they used to allow a level as high as 60. And I just told you that about 100 micrograms per deciliter could be a fatal dose to a small child. So we were actually allowing the blood lead level to be as high as over half the fatal dose, which is alarming. But there has been a number, again, through childhood lead poisoning prevention programs funded by CDC, HUD, the Department of Housing and Urban Development has done a number of research studies along with EPA to identify what happens when lead gets into the human system. And so you can see that from 1960 to 1990, we went from 60 to 10 micrograms per deciliter. Then we went to 5 in 2012. And in 2021, we went to 3.5. And this again is for children. And typically, again, we're talking about from 0 to 72 months of age or 6 years of age. So now I'm going to talk a little bit about OSHA and what OSHA requires. And OSHA is the Occupational Safety and Health Administration. So it is designed to protect the worker. They do certainly have some measures in place to keep the worker from taking any of their contaminants home with them, be it lead or other contaminants that they work with in the workforce. But they are not focused on the family's health, they are focused on the worker's health, and these requirements apply to the employer. So again, general industry covers all occupational exposure to lead except construction and agriculture. Agriculture is, of course, covered by a different agency, and there are some pesticides that have lead in them. So that's where you might think, why is lead an issue in agriculture? There are pesticides that have lead as part of them, the makeup. Construction is a very different animal than general industry. When we think of general industry, we think of someone goes to a fixed facility from 8 to 5 or from 7 to 4 every day, 5 days a week. They do the same thing. They work on a manufacturing line, a processing line, and that's general industry. So OSHA has different regulations for that sort of a facility, whereas a construction worker can go to a different site literally every day, depending on what their job is. and how long the jobs last. And so each job might present different hazards. And the job might last a day, it might last a month, it might last years. So these are the activities. That's why OSHA has different standards for general industry and construction, because certain things are less feasible in one versus the other. So demolition, removal and encapsulation, new construction, alteration, repair or renovation, installation of products containing lead. Like, let's just say you're a roofing contractor and you install lead roof, you put either replace or add new roofs on top of old roofs. There is lead flashing is one of the things that is often used around chimneys and other corners where they need to ensure water prevention, water intrusion prevention, or prevent water intrusion. Let's say it that way. Anyway, so there are things that people are installing on construction sites that might contain lead. Might not be lead paint, it might be many other products that might have lead. Lead contamination, emergency cleanup, transportation, disposal, and storage, and then maintenance operations associated with construction. So OSHA has 2 air levels for us, an action level of 30 micrograms. So again, we're talking about a millionth of a gram, but this time instead of a half a cup of blood, we're talking about a meter. And a cubic meter is, if you've seen a yardstick or a meter stick, it would be a cube roughly the size of a small office desk, if you can picture that. So that's the amount of lead allowed in the air in that amount of air. And we use air sampling pumps to determine the exposures. Then we have a permissible exposure limit, which is 50 micrograms per cubic meter. The action level triggers certain activities, and the main key word there is the employer should take action, because you don't want to have your employees get to or exceed the PEL, the permissible exposure limit, because then the entire standard applies to that activity. So these air levels are both applicable to both general industry and construction. Then we have one little twist with the lead standard. It's really the only chemical standard that has this twist, where if your employees are working more than 8 hours a day, then you have to, the PEL is lowered by taking 400 and dividing by the number of hours worked. So the easy one to do is if they work 10-hour days, you take 400 and divide it by 10, and your PEL is now 40 instead of 50. So that is something that employers have to think about if they allow extended work days. And then, as I said, there is something called a competent person. And a competent person under an OSHA standard, a substance specific standard, is where you'll see this term. They have to recognize potential sources of exposure, and in this case, exposure to lead. They're able to estimate the extent of the exposure. And if you're dealing with construction, we talk about something called trigger tasks. And they have to have, which is the hardest part, they have to have the authority and the assertiveness to take corrective action. So if they see someone doing something wrong, that might be, let's just say we have tools that we have ventilation added, shrouds added, and a vacuum added to it, so that the dust that's generated during that activity is pulled away from the individual. Then you are going to have to take correct, and if they're not using that tool in the proper way, and the competent person and supervisors have to watch this, then you stop the worker and re-educate them on how to properly use the tool. So that's what we're talking about, actually stopping the work to make sure that they're using all the engineering controls and work practice controls that the employer has in place to reduce their exposure to lead. So this slide is a very old slide, and some of you may have seen it before if you've taken any other lead training classes. This slide is an overpass, obviously. with a playground underneath, so that, you know, the kids, when the weather is inclement, they can actually maybe play on that merry-go-round, and that little thing, gray thing, and to your left, just in the shadows, is a metal painted dolphin on a spring, so it rocks back and forth for the child who plays on it. So I typically in classes will ask, what are the sources of lead in this slide? And some people are very quick to notice that the structure has sort of a blue coating, a paint on it. And so that paint could have been lead paint. And again, I mentioned that lead has been banned in paint actually, I might not have mentioned it, for consumer use since roughly 1978. So if you buy a house that was built like last year, it should not have any lead-based paint used in that house. If you bought a house that was built in 1980, it is possible there was still lead paint available because OSHA allowed companies to use what they had, paint manufacturers, what they had in theirs, the distributors might have still had. But typically we expect any house or apartment building or townhouses, whatever, multifamily or single family housing, to not have much lead or any lead paint on inside or outside the house if it was built much after 1978. But before that, it might have. So this superstructure, this overpass, looks much older than that. So there could be lead in the paint. And before we had real strict containment requirements for painting, this might have well been sandblasted, and therefore all those chips are going to fall where? They're going to fall down into the sand. And so the sand or the soil could be contaminated with lead paint. The bridge used to have vehicles going over it that were fueled by leaded gasoline. So historic leaded gasoline use might also have created contamination of the soil below the overpass. And the other one is the actual painted playground equipment. Those are metal painted playground equipment. One of the things I didn't mention is one of the reasons lead paint was so popular is lead mixed with other chemicals or other constituents make bright colors, very bright colors. That's why red leads, bright reds, bright yellows, bright greens. And so a lot of metal playground equipment from back in the day was painted with high lead paint because it was bright, so it was attractive, and it would last. It could stand up to weather and heat and cold and not start peeling as quickly as other paints might have. So that playground equipment is a potential source if that paint is not in good condition, and over years it will eventually degrade. So an exposure assessment is determining the exposure to employees. Again, under general industry and construction, we basically have pretty much the same requirements. The initial determination is to determine whether employees are exposed at or above that action level of 30 micrograms per cubic meter. You are allowed to rely on historical data. However, it's not very historical by the historical society terms. 12 months is not that historical, really. So if you were doing in construction, if you were doing a job in phases and you have air sampling on phase 1 and phase 2 involves much of the same activities using the same engineering controls, work practice controls, and it was done with the second phase is done within 12 months, you could use the sampling from the first phase for the second phase. If it's not done for 3 years, you'd have to do additional monitoring, air sampling, to determine what the exposures the employees are exposed to. You can rely on objective data, which means the object. So again, that lead flashing example I used with roofing contractors, they probably have, through their professional associations and their own sampling, lots and lots of data on if they're cutting lead flashing, these are the exposures that our employees are exposed to. So we know that if we do this and this, we won't be overexposed. So that is an option, but it's only available in construction. And again, if you're using objective data, you have to have some information that the lead content is the same. You can't use objective data from a job where the lead percentage was, let's just say 2%, or 0.8% lead, and one that was significantly higher than that. In construction, you also have something called the trigger tasks, which means if you don't have air sampling, you have not done, this is your first lead job, let's just say, you don't have any data on what your employees are going to be exposed to. If you're doing manual demolition of structures, hand scraping or sanding, again, OSHA doesn't talk about lead paint necessarily. So it's not just lead paint that we're talking about. We're talking about hand scraping or sanding of anything that contains lead. And again, it is the employer's responsibility to determine if there is lead in the work area. So if you're a construction employer, or if you're a demolition contractor, you have to find out from the owner or your client if there is lead present in coatings or any part of the process that your employees are going to come across. So manual demolition, hand scraping or sanding, use of heat guns, which is shown in the bottom right picture, power tool cleaning, where you're cleaning surfaces, but you don't have a dust collection system, or I'm sorry, you do have a dust collection system, or spray painting. And again, spray paint, there are paints still allowed to have lead in them, but it has to be for, it cannot be for consumer use. Residential use. So that's trigger task 1. The employer must presume their exposures are going to be 10 times the permissible exposure limit. So that means 10 times 50 is 500 micrograms per meter cubed. That is what the employees are going to be exposed to, until you, or unless you get air sampling data that shows the levels are below that. But until you have that data, you have to presume. Trigger task 2 presumes 10 to 50 times the PEL. So now we're talking about power tool cleaning. We're using power tools for cleaning, but you don't have a dust collection system attached to that cleaning mechanism. Movement or removal of enclosures. Often this is in steel structure work, where they have enclosures to protect, the river. It's a bridge work. They're trying to protect the river below, train tracks below, whatever it is. So those enclosures that they construct to keep the debris inside. Sometimes this is not as much an OSHA issue as it is an environmental issue to prevent spread of the chips and debris. Also clean up where dry expendable abrasives are used. We're talking about sandblasting, but there are a lot of, because of the silica standard, we try to avoid using sand for abrasive blasting. Now we try to use other non-silica containing abrasives like garnet, there's CO2, there's all sorts of different creative ways to blast without generating other hazardous exposures for the worker. Lead containing mortar and rivet busting. Okay, so that's 10 to 50 times the PEL. That then assumes exposures up to 2,500 micrograms per meter cubed. And the last one is trigger task 3. You have to presume you're more than 50 times the PEL. And abrasive blasting is in there, welding, cutting, and torch burning. And the picture on the slide that you are seeing is, this is an old slide from before the HUD regulations and guidance were changed. And this worker is actually burning lead paint off the metal casings around a doorway. That was the only place that had lead paint, were the metal painted trim in this housing unit. And all I can tell you is, if you want to get lead poisoned, burning lead paint off is one very effective way to get lead poison. You create an inordinately tiny fume, and if inhaled or ingested, is much easier to be absorbed by your system and get into your bloodstream. So it is, I'm happy to say that burning of lead paint is banned by EPA in housing and child occupied facilities, which would include daycares. It could include, depending on your state regs, pediatric wings of hospitals. It certainly does include pediatric hospitals, as schools. Again, anywhere where children under 6 spend a significant part of their day. Under 6, up to 72 months. So you are not allowed to burn paint off housing. That is banned by EPA under both the renovation and remodeling rule and their other regulations dealing with lead in housing and child occupied facilities. Cutting or torch burning. Okay, those are all trigger task 3. So if you have no sampling to prove otherwise, you must assume that your exposures are more than 50 times the PEL, so over 2,500 micrograms per meter cubed. These are just some examples. This is somebody torch cutting or grinding and cutting a steel beam, some sort of metal surface. And the other one is that previous slide, but this, even though it looks like it's just a bad picture, a foggy picture, that is actually the lead fume that was generated. I'm happy to say that the contractor who was doing this job was actually wearing airline supplied, something we call type C respirators, which give you a high level of respiratory protection. So their blood leads did not go up. They actually went down during this job because they had such high level of respiratory protection. But OSHA does not allow an employer to rely on respirators. They are required to do everything they can to keep the levels below the PEL. And only if that's not possible are they allowed to put them in respiratory protection. So personal protective equipment, we call it the last line of defense. And that is something that OSHA is very strict about. So these are the requirements about if your initial determinations are what we call positive, which means they're at or above the action level of 30, then you have to, but they're below the PEL of 50, you have to monitor every 6 months. Okay, that's easy in general industry because it's a fixed facility. Not so easy in construction because the job might be over before you ever get to 6 months. But that is the requirement. If your air monitoring results come back over the 50 micrograms per meter cubed, again, that's assuming an 8-hour work shift, because remember the PEL is lowered if you work more than 8 hours in a shift. Then you have to do it every 3 months. And then you also have to do it if there are changes in the process, changes in what you're working on, how you're dealing with the lead. Again, this is not specific to lead paint. This is lead in the work area. Then the competent person also has to make sure there's additional monitoring if something changes that could increase the employee's exposure. If your results are negative, which is what every employer would like, it's less than the action level, and you really don't have to do additional air monitoring unless you have a change in process, controls, and those are work practice controls, which are designed to reduce exposures, or equipment, which might result in higher exposures. Okay, and of course, OSHA requires documentation of these positive and negative and repeat monitoring. Under the general industry standard, once you are over the PEL from day 1, you must implement engineering controls, and engineering controls can include that local exhaust ventilation that I was describing, where you have a port on a power tool that is attached to a vacuum that is equipped with a HEPA filter, and you ensure that, and it often then has a shroud so that the dust is captured at the source. And therefore the employer has very little risk of exposure as long as they use the tool properly. If the employee has very low risk of exposure, then the air levels that would be measured while that employee is using that engineering controls would be reduced. You have to require respiratory protection if you're over the Pell. You have to have a written lead compliance program that is specific to the facility. So for construction, that means it has to be modified for different construction sites. Mechanical ventilation, which could mean you have something we call negative air machines or air moving machines, which move and filter the air, again, using a HEPA filter or HEPA filter, high efficiency particulate air filter. That is the requirement of the lead standard. Lead is not filtered out by a general household vacuum or a general shop vac. So you have to use HEPA filtration to capture the tiny lead particles. Administrative controls, that includes something we call job rotation. It is not something we industrial hygienists are a big fan of, but it is allowed by the lead standard, where you have someone work in a exposed area for a couple hours and then put someone else in. It from a management standpoint, it means you now have more people exposed than just one. The better option, of course, is to use the other options to reduce the exposures to keep it below the Pell. And then good work practices and hand and face washing are critical. So here are some of the engineering controls. Use wet methods when grinding, sanding, or cutting objects with lead. Use locally exhausted or ventilated tools. Use that HEPA vacuum or wet wiping methods for cleaning. You are not allowed to dry sweep or use compressed air to blow dust off of surfaces. You're also not allowed to use compressed air to blow dust off yourself. Like at the end of the shift, we see a lot of people in various industries who use compressed air. There's a danger because of the force of the compressed air to the individual. Plus, it also re-entrains any contaminant back into the air and gives those contaminants another opportunity to get into your body, either through inhalation or ingestion. Again, these are the types of cleanup methods: HEPA vacuum and wet cleaning methods. They can be as simple as a pump-up sprayer that you can buy at any hardware store. Again, compressed air and dry sweeping are prohibited by the OSHA lead standards. Respiratory protection, general industry and construction, it's required when your engineering controls or work practice controls are being installed or implemented, during activities when engineering and work practice controls aren't feasible for a variety of reasons, and difficult is not the same as not feasible. So sometimes, you have to use a little ingenuity. If your sampling is showing that your engineering and work practice controls are not they're not feasible to reduce exposures below the PEL. And again, OSHA would definitely challenge an employer if they say, yeah, we've tried everything and it doesn't work. They're going to want to see how effectively you've tried everything. And in emergency situations, because you do not know the exposures. Again, in construction, if you haven't done air monitoring and you don't know what the exposures are for those employees doing those tasks, you must use respirators based on the trigger tasks. You also must provide a respirator when an employee requests one, even if your employee exposures are below the PEL. This is a requirement of the lead standard. It is protection because of the negative health impacts that lead has on the human body, both male and female. It's a requirement. You must give it to an employee if they request one, even if the air monitoring is low. If you're over the PEL in both general industry and construction, you can see that it can be very expensive for the employer. You have to have respiratory protection. You have to have other personal protective equipment. You have to have change rooms where they put on their work clothes and leave their street clothes. They have to be kept separate and clean. You have to have showers. And again, where feasible in construction, inconvenient is not the same as not feasible. All right. There are portable showers. There are portable, you go to any event now and they have an amazing porta potty, hand face washing facilities. There's a lot of places available, and showers can easily be available if water is available on the site. That I understand can be an issue, but you can also get facilities that come with the water. Eating facilities have to be separate and not lead contaminated hand and face washing facilities. They say hand washing, but they also in the standard emphasize face washing because we get a lot of dust on our face. And housekeeping, keeping surfaces as free as practicable of lead accumulation. And OSHA can and will conduct dust wipe sampling to see if your clean rooms, your change rooms, your eating facilities are actually being kept free of lead accumulation. Because of the effects, the health effects of lead, the lead standard and most substance specific standard, lead is the substance in this case, have medical surveillance and medical removal requirements depending on the actual standard. So if your employees are over the action level for more than 30 days per year, you must do a medical exam. That employee must be given a medical exam and biological monitoring. Biological monitoring is a fancy way of saying blood lead tests. And it's not just blood lead, it's blood lead and something called a ZPP, which is zinc protoporphyrin test. Those two tests must be done as part of the lead standard. Okay, this is in the general industry. Medical removal and the difference between general industry and the construction is the most pronounced in this section, the medical removal. Periodic or follow-up blood lead levels greater than or equal to 60 micrograms. You'll remember way back when we were talking about childhood blood lead levels, and 60 is more than half the fatal dose for a child. And now we allow, we want children to not have blood lead levels above 3.5 micrograms. You should also remember the chart I had that went over all the different health effects of adults that started, really they start at 5 micrograms. But OSHA, this is what the OSHA standards still say. And OSHA, I'm happy to say, is currently in the process of revisiting these medical levels and blood lead levels and medical removal levels. So if you have periodic and follow-up over 60 micrograms per deciliter at your employees, or an average blood lead level over the past 6 months, or the last 3 tests average over at or over 50 micrograms. The employee is not allowed to return to the lead exposed environment because of an elevated blood lead level until 2 consecutive tests are below 40, at or below 40, which again is not remotely a safe level, but that is what the OSHA standard says. If they're removed by medical determination, the employee can remove when the medical professional states there's no risk of impairment. So there might be another reason that the employee is removed for medical reason, not just the blood at a different blood lead level, because the physician or licensed healthcare professional believes that they might have impairment at lower levels. You must pay them, they must have benefits for up to 18 months. In construction, it's a little different. Your exposure isn't triggered at 30 days, it's triggered at 1 day. And the medical surveillance, so that's the initial, that's the blood lead sampling, the blood sample. Medical surveillance program is triggered at the action level for 30 or more days per year. Medical removal is at greater than 50, 2 blood leads at greater than 50 instead of 60 for general industry. Again, the return level is the same. You have to have a 1 and a follow-up. Two samples show that their blood lead has gone down to below 40. And again, benefits up to 18 months. Again, construction sites might not last 18 months, or as long as the job lasts. So these are the blood lead level. This is a chart of the reference blood lead levels for adults in the United States. OSHA's medical removal level are up at the top. Return to work is at 40. The healthy people 2020 objective and the OSHA objective in 2010. Occupational safety and health objective was 10, and now under NIOSH, National Institute for Occupational Safety and Health, CDC, under their adult blood lead surveillance program, they feel that 5 is a notifiable condition. So you can see that the OSHA lead and construction standard, the general industry standard came out in 1978 based on 1960 science. The construction, the full interim construction standard came out in 1992 or 3. And since that time, it is well studied and well known that levels much below 40 cause negative health impacts. So the average blood lead level among adults from 2009 to 2010 was 1.2, and I think it's even lower now. Because we've done a lot of good work getting lead out of our environment, but unfortunately, we still have a lot of people who are occupationally exposed to lead. So current occupational lead standards are not protective for workers and their families. Occupational lead standards definitely need to be updated. And I'm happy to say that OSHA has accepted comments and is looking to lower the blood lead levels, both what triggers being removed from a workplace and what return to work levels. And this is CDC, the World Health Organization, and many other international public health entities have clearly acknowledged that there is no safe level of lead in the body, period. The last thing I'm going to just talk about with the lead standards is training. You can do general training as part of your HAZCOM training. Hazard communication training is required if your employees are exposed to any hazardous chemicals, both general industry and construction. So you can incorporate lead into that training. You also have to, if you're under general industry, you have to incorporate training on appendices A and B if there's any potential for airborne exposure to lead. And if the exposure is over the action level, you have to do annual training, initial and annually, if you're ever over the action level. And there's a lot of additional detail in the appendices to the standard, dealing with medical surveillance program, respirators, medical removal, engineering controls within the standard. And last but not least, record keeping. OSHA requires employers to maintain records. Exposure data, that's your air sampling data, and medical surveillance data from the blood lead levels and the medical surveillance has to be kept 40 years or duration of employment plus 20 years in the general industry. Medical removal has to be kept for the duration of employment. Under the construction standard, exposure data has to be kept at least 30 years. The medical surveillance has to be kept duration of employment plus 30 years. Medical removal, again, at least duration of employment. And something called objective data we talked about, if they're relying on it, previous air monitoring results from the same kind of material has to be kept for 30 years. Having said all of that, I strongly encourage, because of the health effects of lead, and it might take a while for someone to realize that they have an issue, and they might come back to say, I wasn't properly protected on my job, and I now am having trouble having a family. If you medically remove someone or you did any training, I would really recommend that you keep it for as long as you keep everything else, because someone might come back. And you need to be able to, as an employer, you need to be able to prove that you were following the requirements of the OSHA standard at a minimum. There are test kits for lead. Lead check swabs are probably the most common one in this part of the country. I'm, of course, in Atlanta. If you're in the Northeast, I know the state of Massachusetts has a sodium sulfide test kit. The bottom line is that OSHA really doesn't allow you to use a lead check swab to say there is no lead. They allow you to use it to say there is lead. But sometimes these test kits can take a long time they basically have to use an acid and a chemical called sodium rhodizonate to make a color change. And in order for that color change to happen, the acid that's in the test kit has to be able to dissolve some of the lead, and that can take hours and hours and hours. I have lead paint in my house. I live in an older home, and we did some testing on some door trim inside our house. And it didn't turn colors, but then the next morning we got up and we had a nice dark pink color, because it turns red with lead. That's the sodium rhodizonate method. So if you don't wait long enough, you might assume it's not lead, and it is. So hence OSHA does not accept this type of kit for negative, but it's a great tool if you don't have time to send a paint chip sample in and it turns red, then you know you have lead and you follow the requirements accordingly. And another way of testing lead in paint, we talked about XRFs and taking a paint chip and sending it off to a lab. But lead in dust there is dust wipe testing that you can use, where you get the dust wipes from a lab and you submit them in a tube, and they will analyze and tell you how much lead in dust is on surfaces. And that's a way to check the cleaning. That is required in many residential and child occupied facility jobs, most of them actually, if they're dealing with lead paint. There's a small entity compliance guide, especially to the Renovate Right, EPA's paint renovation, repair, and painting regulations, which is really helpful figuring out how to comply with that. And in summary, the definition of lead-based paint, EPA and HUD have a definition of lead-based paint. CPSC has a definition of lead-containing paint. OSHA has no level of lead in a product or a process that triggers the standard. Worker exposure level is what dictates whether the standard applies. If there's lead present, the employer then has to determine what the employees are exposed to. I think I covered gave you enough information on the health effects of lead to tell you there is no useful purpose for lead in our body. We do need some essential minerals and elements, but not lead. It is toxic at any level. There's a lot of different jobs that might have lead exposure: construction, demolition, painting, and obviously lead abatement and things like that. OSHA has lead standards, the PEL and the action level. And there are task triggers if you're covered by construction, and the allowable blood lead level for adults is much too high in the OSHA standards. So final thoughts: beware of take-home lead contamination. Make sure if you do have a job that exposes you to lead and lead dust, that you clean your clothing before you go back, using a heap before you leave the work area, using a HEPA vacuum, or leave, if you can, leave your work clothes at the site, leave your boots at the site, and wear home clean clothes, street clothes that you came to work in. Promote personal hygiene, that hand and face washing before eating, drinking, smoking, any of those things. You're not allowed to smoke, eat, or drink in work areas. Monitoring and enforcement of policies is critical for employers, and training, and retraining. There's a lot of information on these various websites. I encourage you to go to them if you have questions. And that does it for my share. Thank you very much.
Thank you so much, Vicki, for providing a great background on lead exposure, what it can do for your health, and what the roles of different regulatory agencies are for both employers and employees. So now, my name's Jenny Houlroyd. I am a certified industrial hygienist, and I manage the Georgia Tech OSHA Consultations Health section of the program. And we are going to switch topics, and not switch topics completely, but we're really going to hone in on this concept of how do you prevent take-home lead exposure, and what are the roles of both the employer and employees to protect their families from bringing that type of exposure home. So the reason why we really wanted to engage in this focused area is because approximately 24,000 children in the United States have lead poisoning due to lead dust being brought home from work by their parents. And there are a variety of different ways that both employers and employees can help prevent that lead exposure. To begin, employers can provide lead-free material substitutions when those substitutions can be made. Excuse me. They can also use different types of push and pull ventilation systems that will deliver in fresh air from a separate source of exposure and move air downrange towards a HEPA filtered exhaust area. And it's also the job of the employer to make sure that that is fully functioning and operational, which means changing out the filters on a regular basis. The employer is also required by law to provide protective clothing for workers performing cleaning and different maintenance tasks. Other ways that employers can help is, as Vicki stated, really train workers, and not only training them on what the lead standard is and the health effects of lead exposure, but then also how to properly use these dust suppression systems and proper cleaning methods such as HEPA vacuuming or wet methods, so that when you're working in clean work areas and surfaces, or when you're cleaning up work areas and surfaces, you do not leave any exposures. And one thing that's incredibly important is that employers need to make sure that they're not allowing employees or other individuals in the area to do dry sweeping, because this can create airborne dust. And so this is something that we've seen happen at shooting ranges, where guests of the shooting ranges will be sweeping sort of all the materials that are discharged from the shooting process, and the jackets of the ammunition, and in that process they end up disturbing any lead dust that might be generated from the process of shooting, and this is a way that lead dust gets into the air. So if you do, however, have situations where there's known lead contamination in the air, it's important that when you do things like changing filters or cleaning up or cleaning out air ventilation systems and vacuums, that employees who do these dusty tasks or hazardous tasks are provided with an appropriate respiratory protection. And most importantly, making sure that when a worker is leaving an area where there may or may not be exposure to lead dust, that workers have ready access to hand washing stations. And that includes providing wet wipes if sinks do not close, are not close to that source of exposure. And it's really amazing the improvements that have happened over the years, that construction companies can rent portable hand washing stations. So saying that hand washing stations are not readily available is becoming less and less an issue, because there are a lot of different tools and resources out there that can make it happen. So it is a shared responsibility by both the employer and the employee to do everything that Vicki covered in related to the lead standard, but then also make sure that it's done properly. So while the employer has to provide the training, perform air sampling and dust wipe sampling, send employees off for medical surveillance, and see what their exposures are to airborne lead concentrations, but they also have to investigate and install engineering controls and provide clean change rooms and washing facilities. The employee has this responsibility of following that guidance, right? And so employees have to use the appropriate personal protective equipment that is required for the tasks. And then they have to clean and properly store any personal protective equipment that is designated as being reusable. And then following any decontamination, they have to be able to follow those decon procedures that are identified to be done at the end of the day. And it is strongly encouraged that any employee that is offered medical surveillance by their employer to participate in that program, because that is the only way then an employee will be able to identify early signs and symptoms of lead exposure in their blood. And then more than anything else, what we have seen out in the field is that employees need to make sure that they keep their devices, cell phones, out of the workstation, because they can become contaminated and then transfer that contamination to their kids. You know, you get in the car at the end of the day, your kid says, "Hey, can I play a game on your phone?" You hand them your phone, and suddenly the child is handling a device that might be covered in lead dust. And then also keeping shoes out of the car and home, which is why Vicki iterated it, and then I'm reiterating it, is that you really need to have a set of work shoes and a set of home shoes that are separate. So one of the reasons why we're focusing so much on this topic is because it's not just workplaces that have exposure to lead. So battery manufacturing, construction and demolition, radiator repair, lead smelting, lead brass, bronze casting, foundry operations, ceramic and plastic manufacturing, they all have to do with jobs that you might have. But there's a whole variety of things that people might do at home, like fishing tackle manufacturing, or maybe you might go to a firing range, either as a participant or as an instructor. Bridge construction and repair might be a job, but then similar, there are exposures with home remodeling and renovation that might have exposure to lead. We have interacted with individuals that manufacture and build their own ammunition and bullets, or you might do some plumbing or pipe fitting at home to fix some of the plumbing in your house. People who are into robotics and that sort of thing, they might be soldering electrical circuits, or into artistic things like stained glass making and antique refinishing. So there's a variety of different avenues, which may either be jobs themselves or hobbies where people might have exposure to lead. When we talk about clean rooms and hygiene facilities, this is really the first step to making sure that when an employee leaves work at the end of the day, or leaves an area where they're working with something that might have lead, to prevent it from being brought home. So change rooms should have separate storage facilities for both the PPE and the street clothes. And there should be hand washing facilities where you can wash your hands and face at the end of the work shift, and making sure that these areas where there is lead exposure, there is no eating, drinking, smoking, chewing tobacco or gum, or applying cosmetics, or using the toilet taking place in that same location. So the Seattle Times, Mark Nolan of the Seattle Times, produced these amazing graphics that really kind of demonstrate when, as an example, either for work or a hobby, if you go to a shooting range, you might be exposed to lead. So you're handling a gun, right? And you are at the shooting range, and the ammunition may have casings that include lead. And so when you're using the gun, lead particulates escape and can land on your face and hands, your shirt, and on your shoes and pants from the floor exposure. And so the process of transferring it is from the range to the clothing, to the car, to the home. And what we're really interested in doing is stopping that exposure at the source, because what happens is when employees are exposed to lead at work and it gets on their hands or shoes or clothing, then their kids could hug them or come up to them and be talking to them and sitting on their lap at the end of the day, and they get the exposed. And then what we end up finding out is that a child might test high for lead exposure. And so when that happens, one thing you should be aware of is that the Department of Public Health would be notified, and they have to investigate a cause. So we have alliance between the Georgia Tech OSHA consultation program, the Occupational Safety and Health Administration, and the Department of Public Health to really help cut that cycle down and stop that exposure from happening, by making that link between work-related exposure and a child. So Vicki already covered the variety of different ways that lead can cause damage to the body in both adults and in children. But just to reiterate, lead exposure, first off, lead should never be in the body, so any lead exposure can cause harm. And in adults, it can cause a variety of effects to both the brain, the digestive system, the nervous system, the reproductive system, the kidneys, the cardiovascular system, and the body. And as Vicki described, one of the biggest impacts on children is the neurological changes that take place that can lead to behavioral changes and hearing loss and learning disabilities, and that these can be permanent changes that occur. So we really want to focus on preventing that exposure in children. So what are some simple steps that can be done to reduce that exposure? First, um, do not eat, drink, or smoke on the job where there is lead exposure. That means that before you want to go on a smoke break or have something to drink or go to eat, you want to be washing your hands and hopefully also washing your face and arms, because some of that contamination can spread to those different areas, and that any of the personal protective equipment that you're wearing on the job, including a respirator, is removed before going to those places to be eating and drinking. And, at the end of the day, you should be really showering and washing your hair and changing into a separate clean set of clothing before leaving the workplace. Um, when you show up to work in the beginning of the day, your street clothes or the clothes you wore to work should be stored in a separate locker to keep them clean and uncontaminated from your work clothing. And your employer should provide opportunities and offer a method to wash the work clothes separately from other laundry. And that after washing lead contaminated clothing and removing them from the machine, that whatever machine is being used should be rinsed and go through at least one rinse cycle before being used again. One thing that's really fascinating about lead exposure is how much more is absorbed on an empty stomach. And so proper nutrition is a primary method of reducing and preventing the absorption of lead into the bloodstream. So really eating a well-balanced diet will benefit you not only because it's a balanced diet, but also because it'll reduce the potential for absorption of lead. And really consider, if you have hobbies outside of your job that may have lead exposure, to speak with your physician to see whether or not you or your children should also be getting blood lead tests. If you are exposed, as Vicki described, above a certain level, under the lead standard, your employer is required to send you for that blood lead testing. And you are within your rights as an employee to ask if you are to be offered that as part of your job. Some things to consider is that you should be cautious. Lead dust is small. It's so small that it cannot be seen with the naked eye. So we go out to lots of facilities where we'll wipe somebody's hands after they think they washed their hands and they actually didn't wash them well enough. And we'll get measurable, considerable amounts of lead dust off of their hands when we give them, we do a lead wipe sample. Protective clothing is only as good as how well it's worn. So it needs to be worn properly. It needs to be donned or put on and doffed, which means take off, in the proper order so that you're not causing cross-contamination. And that if you are wearing a respirator, you need to be clean shaven and make sure that the respirator is fitted properly. So that means your employer should be doing some form of a fit test, which means they're checking to make sure the respirator is the right size for you. And then every day when you put it on, you should be doing what's called a user seal check, which is a simple test that you can perform to make sure that the respirator is seated properly on your face. One of the biggest and most simple things you can do is just to minimize the transfer of lead dust to your vehicle, and consider your vehicle as being the first part of your home that you're going to interact with at the end of your shift. So you want to keep personal items clean and away from your work environment, and really focus on not bringing contaminated shoes into your car and then to your home. So one question that we've had pretty regularly is, what do you do if you think your home has been contaminated? So let's say you're working somewhere where you think you may have been exposed to lead and you may have been inadvertently bringing it home. There's things that you should consider. There are two effective cleaning methods that will remove the lead dust from your home. The first one is wet washing. And then the second one is cleaning using a special HEPA vacuum. And so really what the most effective method would be is some combination of both. And if you think there might be exposure, it should be done regularly. So a basic supply list of things you could have, and this is all from the State Health Department in Minnesota, is you should have a HEPA vacuum, meaning it is a vacuum cleaner with the filtration system so that it can properly and effectively remove lead dust based on its size. You should select a non-toxic household cleaner, 2 buckets, and we'll explain how to use them in a minute. Some disposable rags, so take some old towels that you don't need anymore and rip them into rags, and then some heavy duty trash bags to properly dispose of the contaminated material, rubber gloves, and a disposable cloth sweeper, and an example of that would be like a Swiffer. So the way this procedure takes place is you put on rubber gloves and you mix a cleaning solution in one bucket. And so that would be like any type of mild detergent. And then you fill the other bucket with clean water. And so you take a sheet of a disposable rag in the bucket in the cleaning solution and you wipe down the surface. It might be your windowsills, your window wells, your door frames. It could be the walls or the floors. Maybe it might be the entryway to your house where you come in at the end of the day and before you take your shoes off. So maybe that's the area you want to be focusing in on. And so after you wipe down that surface with the detergent, you throw that dirty rag away after, because you don't want to get contamination in the bucket, and you continue that process. You might want to do it a couple of times with a couple rags until you get a cleaner surface. And then you're going to use a new sheet paper towel, thick paper towel or disposable rag into the bucket of the clean rinse water and wipe down that surface that had been washed. And so you're going to throw that rag away as well. And so you're going to put the buckets into the toilet. You're going to pour them down the toilet, and you don't want to put it in your sink or your bathtub. And that's primarily because any residual might end up on surfaces, and then you don't want to then sit in the bathtub with residual lead dust at the bottom of the bathtub, or to put dishes that you use to eat off of into a sink that might have lead dust in it. For the dry method with using a HEPA vacuum, you always want to make sure that the vacuum cleaner has high efficiency particulate air filter. We recommend, if possible, renting an industrial grade version. You don't want to use your normal household vacuum because that can pick up and hold smaller pieces of lead dust and filter them and send them back out into the air. And they do recommend, if there's continued contamination, doing this vacuuming at least once a week, and more frequently if you have small children or animals at home. And so really focusing on the basic things you can do: washing your hands and your face after using lead or being exposed to lead, but before eating and drinking, showering and changing your clothes and shoes when you work around lead contaminated practice, like we've said repeatedly, having your work clothes washed separately from all your other clothing, and making sure that your employer is providing you with opportunities to do the work in well-ventilated areas. If your employer provides you with personal protective equipment, take the time to learn how to put it on properly, to take it off properly, and ensure that you're using it as a means to protect yourself from coming in contact with that lead. Um, if you are thinking of becoming pregnant, planning on conceiving, breastfeeding, if you are a female that is entering into the reproductive time frame, or you are a male that is trying to conceive with your significant other, then I highly recommend consulting a doctor to have your blood lead tested, and then also to come up with a plan if there is if there is lead in your blood that needs to be addressed, and to give your body time to remove it before you conceive. Um, If your employer has sent you for blood lead tests, your employer is required to provide you with those results. So you can ask for them, and make sure that any potential exposure that did make its way home is cleaned up properly before it can expose others. Um, and we've repeated this again and again, but it's so important. Not drinking or eating in areas where lead is being handled or processed. So if you have a hobby bench in your garage where you're making fishing lures, you should not also bring your cup of coffee out there to drink on Sunday while you're making your fishing lures. You want to have those places be segregated. Um, and be careful that appliances and other household items, jewelry, um, sometimes even toys that are made outside of the US may not have been tested for traces of lead. So the Consumer Product Safety Commission can provide you with information about where they have identified situations where products being brought into the US have been identified as having lead. And the other thing is, please do not let your children put toys or jewelry in their mouths as much as humanly possible. Um, and as Vicki shared a story earlier, some of the jewelry, a lot of the cheap jewelry that comes from overseas can have maybe not lead on the outer coating, but it can have lead on the inside material. And if a child is, picking up their necklace and like putting it in their mouth and messing with it in that way, they can become seriously exposed to lead. And also concerned with them accidentally swallowing it and then it getting absorbed through their stomach. Excuse me. So I hope that you have enjoyed today's lecture about how lead can affect you, what are the OSHA and other regulatory agency standards, and then how to prevent take-home exposure. We have lots more information out there for you. The Georgia Healthy Homes and Lead Poisoning Prevention Program has an entire wealth of information on how to prevent exposure that might be found within the home. Our Georgia Tech OSHA consultation program has resources about lead exposure. And if your employer is interested, we can come out and provide no cost on-site compliance assistance for smaller businesses. The OSHA has a page on their website specifically dedicated to lead exposure, as does the National Institute of Occupational Safety and Health. And EPA also has a lead focused page. So thank you for joining us today. And we will include in the notes of this posted video our contact information.